Here to fill us in on their medicated assisted treatment is Marlise Perez. Welcome.
Hi, thank you so much.
All right, well, this program is really trying to combat the rise of deaths in California due to drug overdoses. Tell me more about what you guys are doing.
Sure. So with the Department of Healthcare Services, we have received some federal grant dollars for here in California to really help with the opioid epidemic, not only to help individuals get treatment, but also to prevent individuals from having this disease. So one of the things we're doing is kicked off a big campaign, Choose Change California, to really just bring awareness about the disease of addiction.
Well, when we talk about substance use disorder, can you kind of just give our audience an idea of exactly what that is?
Sure. So unfortunately right now in America, the leading cause of death is from a drug overdose. And so for an individual that is 50 and under, that's the leading cause of death. And it's very, very concerning across the nation. And what's really attributing to those high numbers is around opioid overdoses. And so in America, 130 individuals die every day from just an opioid overdose. So we really want to be increasing access to services, like I mentioned, but not only for opioids. In California, while we're struggling with opioids, we're also having about the same number of deaths from methamphetamines. And then also alcohol. Alcohol is really even more potent and dangerous here because it's so accepted. So we're really just wanting to bring awareness about what it is to have a substance use disorder and how to get help.
And you're with the Department of Healthcare Services, and you're talking about, all these different things that are going on. So you guys are really concentrating on awareness, getting people help. What other types of things are you working on to help combat this problem?
So here in California, we were the first in the nation to really redesign our substance use disorder services. So we're really proud of that. We've been working on that for the last few years. And really what that means is bringing more services to individuals that have this disease. And once again, it doesn't just have to be with opioids. It can be any sort of substance. And so really creating the care that they need, increasing access to services, especially for individuals that have Medi-Cal, and bringing them the treatment they need so they can get into long-term recovery.
And how are these services being funded?
Yeah, so we in California fund a lot of our services through Medi-Cal, but also a lot of private insurances are starting to fund services for substance use disorders with the Affordable Care Act, parity, all these different laws and attention around this disease. A lot more funding is coming to assist.
And one of the things I know that you kind of mentioned you're working on is getting the access. What is being done so that people can, access some of these treatment programs and services more easily?
Yeah, so some of that is, like I mentioned, the funding, but also it is just the awareness. One of the biggest issues that we face in this country is the stigma around having a substance use disorder. Folks don't really understand it's a disease in the brain. It's a chronic relapsing disease, so that's really, really challenging for families and communities. It's very difficult, but it is treatable. So we want to help individuals understand that help is available and really to fight that stigma to get people into treatment. Otherwise, people are just too ashamed to even ask for help.
When you talk about people being ashamed, what is that first step that they need to take, to kind of start addressing the problem?
Yeah, so what really can help is there's assessments available. So individuals can just come in and get assessment to see do they even have the disease, but also it's just really talking about it. Even for those that aren't struggling with a substance use disorder, we all need to talk about it and help folks know there's no shame in this. This is a disease. Nobody wakes up and says, I want to be an addict today. That's what I want to do. It's a disease and treatment is available.
And how do a lot of people just even start to deal with the problem? Like, how does it come about for many of these people?
Yeah, so a lot of individuals start maybe missing work, or maybe not being able to be present with their family. What happens is when someone is addicted to a substance, it really changes the brain chemistry, and the individual is so focused on the drug is creating this craving and this just overwhelming desire that it just, all other things in their lives take second place, and the brain is actually even being rewired. So it's a very, very difficult disease, like I said, but treatment is available, and all someone needs to do is take that first step to get help.
Well, it's great to know that there's help out there. How can they find this help?
Yeah, so through our campaign, we have a website. It's choosemat.org,
okay.
And that's for opioids or any of the diseases, so they can just access that. You put in your zip code, and then you can see treatment programs available in your area.
And what can individuals do so that they can help with the problem, be part of the solution.
Yeah, so we just got to talk about it. We have to talk about it. We have to normalize this. It's a disease. It's not a moral failing.
All right, so choosemat.org for more information. All right, Marlies, thank you so much for joining us and educating us and helping to create a little bit more awareness.
Great, thank you.
This interview involves commercial content. The products and services featured appear as paid advertising.